and you're like the first.
Yeah.
Okay, this is the urinary tract. So these are the kidneys. Medial to the kidneys is where the ureters come out. The ureters travel to the urinary bladder, and inside the urinary bladder is where the urethra is, the little hole coming out. So if you go to this model, here's the urinary bladder, and here are both of the ureters coming out, the left and the right ureter. If you open the model, you see the inside of the right and the left ureter, and the urethra is this part. This triangular part is called the trigone. Then come over back to this model. This is the inferior vena cava. This is the aorta. Right here, these two indentations in the kidney where the vein, the artery, and the ureter all come in and go out of, that's called the renal hilum. Okay. And then this is the left kidney. You know that because the ureter is medial to the kidney. You have the renal capsule, the outside part. Here's the renal cortex right here. The renal medulla are these lines. And this whole structure, this round structure, is called the renal pyramids. In between each renal pyramid, you have the renal column. There is the minor calyxes right here. Each of these are minor calyxes. The major calyx is this part right here, this part of the tube. You have the renal pelvis, number 4 right here, that connects to the ureter, which is number 3. Here is the renal artery, which goes into the kidney. It connects to the segmental artery, which is where it breaks off here twice. You go up, it goes to the interlobar artery. This part right here is the the arcuate artery. This is the arcuate artery. And these branches are the interlobular artery. And same with the renal vein. It goes in up into the segmental vein, the interlobar vein. This is the arcuate vein, and these branches are the interlobular veins. So, each of these little dots are a separate Bowman's capsule, which is also called a nephron. So if you come over here, this is just a section of the kidney. This is the renal pyramid, and this is the renal cortex up here. So each of these little balls are a Bowman's capsule. If you come over here, it's a bigger Bowman's capsule. The outside part is the capsule. The inside is the Bowman's space, which it collects the filtration fluid. This is the afferent arteriole, which goes into the Bowman's capsule. The efferent arteriole comes out of the Bowman's capsule. So if you look at the big model again, here is the afferent arteriole going into the Bowman's capsule. The efferent arteriole comes out. This white little chain coming off of the Bowman's capsule is the proximal convoluted tubule. It loops down, which this loop is called the loop of Henle. It comes up here and twists again for the distal convoluted tubule, which leads to the collecting duct right here. And that's it.